Lecture 16, Oversensitive Patients, page number 115, 116.
Deep medicines like laxative, sulfur and other deep remedies, even though when they are indicated, really, even though they are exactly similar, but by frequent repetition of those medicines, and in oversensitive patients when they are partially indicated and they are being given frequently, they will leave the bad effects of the remedy. Kent says he knew a case of the bad effects of laxative for more than 8 years, 7 to 8 years. The symptoms of the drug crop out periodically years after it has been abused, and the periodical attacks are perfectly typical of the drug. The mineral substances which are perfectly harmless on the crude plane may be poisonous on the dynamic plane when the patient is oversensitive. There are persons who can drink a glass of milk with impunity and be nourished by it, but upon whom a drop of milk potentized to a high degree and repeated beyond its homeopathicity will establish a miasm that will last for years. Even in crude form, when milk helps them, sometimes in oversensitive patients, when the same milk is potentized and given as a remedy, that may produce poisonous effects. A prover of lac-caninum had a return of its symptoms periodically. She was an oversensitive and proved the medicine indiscriminately and has suffered ever since from its poisonous effects, whereas if it had been given prudently, the disease would have established itself upon the body like any other acute miasm, would have run its course and disappeared. So he has observed a case poisoning with lac-caninum, potentized milk. It is unwise to make provings upon oversensitive subjects in that way. I tested a very high potency of laxative on an oversensitive patient, giving but a single dose, and that patient ran the course of the laxative disease in about 2 months. The symptoms disappeared and never returned. Fortunately, he has given only 1 dose to the oversensitive patient. All the symptoms of laxative have established its picture in the patient, but fortunately, in 2 months, in 2 months it has disappeared and never returned. While the laxative was in progress, the patient's chronic symptoms were suppressed. But after it ran its course and disappeared, her chronic symptoms came back. This is in accordance with the doctrines. She was oversensitive, and while the dissimilar laxative disease was in full blast, her chronic disease was suppressed. Because when the two dissimilar diseases are working in a constitution, what happens that he has explained previously. Which one is more stronger? It will suspend the already existing disease, and it will continue its course, and later the original disease will again come back. In the same way, the laxative disease was there for her. Because it was more stronger, her chronic conditions were suppressed, and after the laxative disease was eliminated, her original symptoms again returned. There are instances when such a patient is truly homeopathic to a remedy, and if that remedy be repeated after enough, I mean in the internal sense, has been given to cure it, it ceases its homeopathic relation, and acting through the general susceptibility creates a miasm upon this extremely sensitive patient. When a patient is hypersensitive, you must avoid to use of the CM and other very high potencies. which will make your patient sick, and use instead the 30 and 200. So we should be very careful while administering remedies in very sensitive, oversensitive patients. Okay. In administering remedies in oversensitive patients. If we do normally when there are when the mental symptoms are prominent, if we administer directly at 50 m or cm or mm or dm potency, definitely it will increase and it will worsen. So in those oversensitive cases, instead of giving the higher potency, you try to give 30 or 200. And slowly you observe the action of the remedy and response of the patient, and then you can slowly increase. Otherwise it will be very harmful. See how clearly he is explaining. We should have been able to meet with many more real natural homeopathic cures of this kind if, on the other hand, the attention of observers had been more directed to them, and on the other hand, if nature had not been so deficient in helpful diseases, in helpful homeopathic diseases. Hahnemann in 46th aphorism gives examples of these natural cures. We occasionally meet with these cures now. We find patients that are threatened with phthisis go to the south, because it has been proved that such cases can go into vitiated climate and stay for a number of years and actually receive benefit from this disease-producing neighborhood and go away well. So the natural things which will cure the conditions, that also he is explaining. Others go into a climate more wholesome and they are not cured. The miasms can cure all similar diseases, and the curing substances are in attenuated form. The evils that arise from these swamps are similar to the evils of the economy of the patient, and that similitude is antidotal, is curative, and causes a change back into order in accordance with the eternal law that governs the action of similars. There was a time in the early days of homeopathy when, taking into view the great array of disease forms to be contended with and the very few medicines then at his command, the homeopath was worried to find similar remedies similar to all his cases, because there were only few proved remedies. There were availability of the homeopathic remedies were very few. At that time there was worry how we can meet, how we can administer, how we can find out the similar medicine to all the things. But when many remedies are there with full proving, then we need not worry. That cannot be true now. If the homeopathic will work in a systematic way, he will be able to command enough of the materia medica to meet all the diseases that he comes in contact with, the symptoms of which are sufficiently observed. Sometimes, even though there are many remedies, well-proved remedies, sometimes we will miss the exact remedy which is indicated to the patient. For example, in a case of asthma, he was having asthma, frequent fever, and frequent cold and cough, frequent vomitings, much weakness. He was much emaciated, and in the early childhood he was known to be having congenital heart disease. To that patient we have tried with many remedies. For example, we have given antimtar, bacillinum, tuberculinum, China. Though there was a little improvement, a palliation, no radical cure for the boy. He was not putting on weight. He was not improving. The parents were very much alarmed whenever he got any fever or asthma. It slowly it used to last for 5 days, 6 days, and 7 days. During that time, he grew much weak after every attack. At one time, I have given Baptisia 1M to that boy. for the fever. He was immediately responded for the first time for the fever without going to allopathy. Previously, there was many times there was need to go to allopathy when the fever did not subside. With Baptisia 1M, there is very good improvement. And with that 1M, the gap was very much increased for the frequent attacks. Previously, he was getting once in 3 weeks or 1 month. After giving this Baptisia 1M, not only that present fever was subsided, but he was very much better for 2 or 2.5 months. After which, again it relapsed. So thinking that the acute condition, he was having cold and cough and all these things, again we started with basin, without thinking that Baptisia was might be the remedy, because at that time, because the fever was prolonged and also the patient was weak and dull, basing upon all these things, Baptisia 1M was given. But when after 2 or 2.5 months, again the fever started with cold and cough, I did not give Baptisia directly. Again, I have tried tuberculum or streptomycin, with which he was getting improvement. But at that time, even after 3 or 4 days, there was no improvement. So I thought, why can't I give Baptisia again? So I have given Baptisia 1M to him. Immediately by next day, he got very good improvement. There was a very good improvement. For 3 months, he was very much better. After 3 months, again there was much cough, cold, and fever. So that time, without any experiment, I have directly given him Baptisia 1M at that time. By next day, he was normal. To my surprise, he was very much improved. With only Baptisia, his cough was better, asthma was cured, frequent fevers completely cured. He improved very much mentally, and physically also his weight improved. He has grown tall with Baptisia 1M. So his exact remedy he needed was Baptisia. For him, that Baptisia worked as a chronic miasmatic remedy. Later, after echocardiogram, the congenital heart disease, it was much better. No problem. It was completely cured. Before Baptisia only, it was completely cured. But after Baptisia, till now, I think it was 6 to 7 months. Till now, he is not sick. He is very active. Active at studies also. So sometimes, even though there are many remedies, well-proved remedies are there, like this we may miss. And what the Constitution will teach us, it will produce an acute condition which will lead us to do that remedy for the acute condition. But unfortunately, after the acute condition subsides, we may think and we may miss that this remedy has cured not only his acute condition, but chronic condition also it has cured. That we will miss. Normally, what we think that that was given only for that present acute condition. But when we observe slowly, his complete condition will be cured by that. Yeah, the nature is very kind enough that it will lead us to the exact remedy by creating the acute condition which is similar to that remedy. In a case of menstrual disorder case, though there were many remedies given, every time she was getting menses very irregularly. After getting menses, the discharge was continued for a long time. Even after giving many remedies, trying many remedies, there was no improvement. One time she got very horrible cough, dry cough, continuous cough, which was subsided with Drosera. So I did not give any other remedy. I have maintained on Drosera only for some time. To my surprise, there was very good improvement in next cycle, menstrual cycle, with the Drosera itself. It was at exact time it appeared, and there was no much discharge. After 5th day, it was subsided, and she improved very well with Drosera. After 2 or 3 months, when there was again menstrual disturbance, I have given Drosera only, without trying for other medicines. So sometimes we may, in the beginning, we may think Drosera will cure only cough, but Drosera is a chronic constitutional remedy. It is having, Drosera has very wonderful mental symptoms. May go through again the materia medica with this mind. We will definitely find out all these symptoms. In Canto materia medica and also in the guiding symptoms. అవి పని చేయలేదు వాడికి వాడిని చైనా పంపించి ఫ్రీగా చైనా పంపించినా వాడేం ఒప్పుకోలే వాడి డబ్బులు ఖర్చు అవ్వకుండా వాడేం వీసాకి అప్లై చేయకుండా చైనా పంపించినా వాడు ఒప్పుకోలే